Robertson.
Thank you, Mr Speaker. My question is to the Minister of Health. Is he satisfied with the cost of after-hours medical treatment?
The Honourable Jonathan Coleman.
For the Minister of Health, I am concerned about the costs of some after-hours services, despite the fact that this government is putting an extra $144 million into primary care over 4 years. There has always been a wide variation in after-hours charges, as these clinics are privately owned. But this government is supporting a range of initiatives, including a new 10-clinic after-hours network in Auckland, nurse telephone triage systems and weekend clinics.
Grant Robertson.
Is he aware that in Queenstown, an after-hours consultation can cost $139 for an adult, $123 for a child, and $102 for a baby? And if so, what is he doing to address that situation?
The Honourable Jonathan Coleman.
Yes, I am aware of those figures, and that's a substantial improvement on when Damien O'Connor was asked about after-hours care in Queenstown in 2004, and he said, quote, "I'm aware of some excessive charges for after-hours services in Queenstown, for example, where some GPs have been asking for over $200. So I think that member would have to agree that under this government, the situation, it is true, it's here in the Hansard. The system has improved substantially.
Grant Robertson.
Parliamentary. What responsibility does he take for high after-hours charges, or does he agree with the Ministry of Health that practices should, quote, check themselves? And when will his government take responsibility for these charges?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health. Well, look, as I said in my opening answer, there is concern about after-hours charges in some areas of the country, but it is a long-standing problem, and we are working to address it. An extra $144 million into primary care over 4 years, and specific initiatives like nurse telephone triage systems, weekend clinics, extra funding for EDs to provide overnight services, and extra funding for longer evening services. So it is a chronic problem, but steps are being taken to address it.
Grant Robertson.
Does he think it is acceptable that a 14-year-old visiting an after-hours clinic in Auckland was charged $66 for a routine consultation, or that a community services card holder in Ashburton was charged $47 for a consultation?
The Honourable Jonathan Coleman.
On behalf of the Minister. Well, look, as I say, there are some issues in various parts of the country, but what we do expect is that DHBs and PHOs will be working together to address this problem, and I know it's a problem that the last Labor government failed to address, and it's not an easy one.
Grant Robertson.
What specific things will he do outside of Auckland to address after-hours charges that are now becoming, according to one provider, beyond the means of many people?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health, I think I've listed quite clearly the specific things that we are doing, but I can go through the list again if you would like. Nurse telephone triage systems, weekend clinics, extra funding for EDs to provide overnight services, extra funding for longer evening services, and a network of 10 after-hours clinics planned in Auckland. $850 million going into primary care, $144 million over 4 years going into after-hours, including $14 million specifically for after-hours services split between rural and urban areas. So, yep, very specific measures.
Question number 11, Tim McIndoe.